that body, we could be able to see only the mesentery and the intestines and the appendix and colon and sigmoid mesocolon. But we couldn't able to see all these things. Why? Because everything is covered by the parietal peritoneum or the posterior abdomen. Right? Getting it? So we have removed the mesenteries and intestines and everything over here, so that we have reached the posterior abdominal wall. After removing the parietal peritoneum of the posterior abdominal wall, you will be able to see all these structures over here. Okay, what are the structures? See here, this is the pancreas over here, kidneys, ureters, actually pancreas, kidneys, this is the ureter over here, similar ureter will be on this side also, this is a similar ureter over here. I'll show in detail later on. And then aorta and the inferior vena cava and psoas major and quadratus lumborum and iliacus. All these things you couldn't able to see before. Before you could able to see only the peritoneum, so all these structures are deeper to the peritoneum. Could you able to understand now? So all these structures are retroperitoneal. Getting it or not? Even the superior mesenteric artery and inferior mesenteric artery also retroperitoneal initially, because this will be arising from the aorta. Aorta is retroperitoneal, but passing through the root of the mesentery, the superior mesenteric artery is going to divide and everything. Entering into the mesentery, so inferior mesenteric artery is dividing into multiple branches. Could you understand now?
Yes, sir.
So the mesentery is carrying these blood vessels and then supplying the intestines over here. But initially the origins will be retroperitoneal. Getting it or not? Because they are arising from the aorta. Okay. So now we are in the posterior abdominal wall. So here will be the lumbar vertebra. Somebody could able to feel it if you want to feel it. Be able to feel the hard ones, right? Okay, could you able to feel that? Hard ones? Carry the gloves, right? Then only you can feel it, appreciate it. Okay?
Tough. Yeah, hard.
Tell them to be gentle, right? We're doing a research on that body actually. Seriously, we're doing a research on that body. Okay. Be gentle, everybody, okay? Be gentle with the body. Be gentle. Be gentle.
आराम से काम करो.
Okay. So this is the lumbar vertebrae, you can understand. These are the lumbar vertebrae over here. Okay. This bifurcation occurs at the level of L4. This bifurcation occurs at the level of this nothing but the veins. Veins are joined together and forming the inferior vena cava at the level of L5. Simple. L4 aorta bifurcation. L5 inferior vena cava formation. That's all. Two inferior vena cava, two common iliac veins joined together and form the inferior vena cava. Okay. Right. Okay. We'll see that. Which is the muscles, vessels and nerves. Okay. First of all, the muscles, see here, on either sides of the lumbar vertebra, this is the psoas major. Could you able to see that? This on either sides, this is the lumbar vertebra. On either sides of the lumbar vertebra is the psoas major. This is the psoas major. Okay. So above, towards the lumbar region, towards the lateral aspect of the psoas major is the quadratus lumborum. Okay. Psoas major towards the lateral aspect, at the level of the lumbar region is the quadratus lumborum muscle over here. Okay. Within the pelvis, within the false pelvis or greater pelvis, why it is called false pelvis?
Because it is not fully covered by the bones.
It is not covered with the bony things over here. Okay, right. So this is the false pelvis or greater pelvis, bigger pelvis, greater pelvis. Okay. Whenever you are entering into the pelvis, again this is the psoas major muscle, but lateral to that, this muscle is the iliacus muscle. Within the lumbar region, lateral to it is the quadratus lumborum. Within the pelvic region, the lateral to the psoas major is the iliacus muscle over here. Okay, right. You can see the demarcation over here. This is the anterosuperiliac spine, this is the anterior inferior spine, this is the notch in between them. Okay, feel it, right?
This is the
anterosuperiliac spine. Okay. Okay. Okay, two elevations over here. Can you feel now? This is a notch over here in between these two. This is the two anterosuperiliac spine, anterior inferior spine. And this is the iliac crest going over here and over here and over here and over here also. Okay. So this part is the iliac fossa and this is the iliac crest over here. Could you able to see that? So iliac fossa will be giving rise to iliacus muscle. This entire is the iliacus muscle, but this iliac crest is giving rise to the quadratus lumborum. Got it? Right? So this is the demarcating point over here. You can feel it. You can feel the iliac crest. Somebody wants to feel. You can feel the iliac crest over here. Trace it backwards, backwards, go backwards. You can feel it, no? Right? Upper margin, right? Iliac crest. Exactly. That is the quadratus lumborum. Okay. Clear up? Right? Okay.
Tubercle is not.
Tubercle will be over here. We can't feel that much. Okay, it's okay. Okay, this is the iliac fossa. That is the iliacus muscle over here. Okay, clear. So far we have seen the muscles of the posterior abdominal wall along with the iliacus. Okay. Okay, these are the muscles we have seen so far, and whatever the fascia covering it is the psoas fascia or iliac fascia. This will be the iliac fascia, and this part is the psoas fascia. Okay, right. So let us see the vessels now. So far we have seen the muscles on either sides of the lumbar vertebra and everything, and now vessels. See, this is the abdominal aorta. This is the abdominal aorta, which is lying in front and towards the left side of the lumbar vertebra, bodies of the lumbar vertebra. Okay, this is the lumbar vertebra as a whole. This is the abdominal aorta, which is situated just leftwards and in front of the lumbar vertebra. Okay, and it is dividing into two common iliac arteries over here. These are two common iliac arteries. You can see that these are the terminal branches occurring at the level of the L4 vertebra. Okay. Okay. So next, the vessel is the inferior vena cava. See here, this vessel is the inferior vena cava. So could you see that? This vessel is the inferior vena cava. Okay, this is the inferior vena. How to identify the difference? The artery is thick-walled and recoiling back over here, and vein is thin-walled and will be recoiling back over here. Getting it down? Vein is thin-walled. You can feel it in this manner. Feel. I'll show the thickness. This is the thinness of the vein. Anywhere vein will be thin-walled over here, artery will be thick-walled over here. Getting it down? Anywhere artery will be thick-walled, vein will be thin-walled. Anywhere in the body. Okay. Right. So this inferior vena cava will be formed by means of two veins which yet to be dissected over here. So common iliac vein on right side, common iliac vein on left side, both will be joining together and we form the inferior vena cava. Always say that, don't say these are the branches over here. These are the tributaries. What is the difference between tributaries and branches with respect to the veins?
Tributaries are going and joining, forming up the larger.
Exactly. Actual vein will be formed by means of tributaries. For example, iliac veins will be going all the way from below upwards and will be forming the inferior vena cava. Okay, these are the tributaries now. But where we can find the branches? Portal vein, exactly. Portal vein will be giving rise to branches of the vein into the liver, because the blood will be directed all the way from portal vein into the liver, not liver to the this thing. But central vein of the liver is carrying the blood from liver to some other place. Getting it, right? So branches are for the portal veins, but the rest of the veins will be having tributaries. Okay, and branches are for the arteries. Everywhere artery only. There are no tributaries for the arteries only, because blood will be carried all the way from above downwards over here towards the branches. Okay, that is the difference. Basic difference. Okay, right. So this is the aorta and this is the inferior vena cava. Don't say it as abdominal vein. Okay, this is abdominal aorta, but this is inferior vena cava. Okay, right. So far we have seen the vessels now. Okay, and one major thing I have to show you. So these vessels, you can see that this is the common iliac artery, is it not? This is the common iliac artery, right? This is the common iliac artery. You can see the movement over there. Okay. See, leave it. This movement you can see common iliac artery, right? Left common iliac artery. So left common iliac artery going over here and bifurcating into two arteries over here. Could you able to see that? This is the external iliac artery which is going towards the thigh, and this is the internal iliac artery going towards the pelvis. Could you able to see that? So no, okay. See here, you have to just bend. Okay, this is the external. This is the common iliac artery. This is the external iliac artery, and this is the internal iliac artery. External iliac artery will be becoming the femoral artery. That's why it is going towards the thigh. But this is the internal iliac artery, which will be giving rise to branches for various viscera within the pelvic cavity. If you couldn't able to tell the branches of particular organ within the pelvis, just blindly remember the external iliac artery will be forming the femoral artery within the lower limb. Okay, that belongs to the lower limb, apart from few branches superficially. External pudendal and everything, those branches will be coming from the femoral artery. Okay, so external iliac artery will be giving rise to the branches for the lower limb, but the internal iliac artery will be supplying all the viscera which are present in the pelvic region. So if you forget the branches, just remember this is the internal iliac artery branch, that is the external iliac artery. Okay. So if you see that, this is, you can imagine that this level is a sacroiliac joint. Is it not? This is the iliac crest. Here will be the sacroiliac joint. At this joint, there is a bifurcation over here. That means the branches are produced over here. Could you understand? So at this sacroiliac joint, the common iliac artery is dividing into external and internal iliac arteries. Okay. So in front of that, whatever the structure you are seeing over here is the ureter. How can I say this is ureter? If you find any difficulty, just trace it from below upwards and it is going into the kidney over here. Okay. So this is the ureter. Okay. Would you able to see that? It is going into the kidney. Right. So this is the pelvis of the ureter, and this is the actual ureter, which is lying in front at the level of the bifurcation of the.
And the between the bifurcation. It is going between the bifurcation.
Okay. you can say that, but actually it is lying in front of the bifurcation because it is a dead body, so everything got deepened.
Oh.
Otherwise, it will be going in front in this manner. It will be going towards the urinary bladder. Okay. So, but the main relation is in front of the bifurcation of the common iliac artery. Okay? That is the main thing over here. Okay, that is main relation over here. Okay, right. So, the rest of the vessels I'll show on the next day. Now we will focus on the nerves over here. Okay, just straight remember. All the way from below upwards we will see. In a sequence, if you see, you can easily remember. Okay, medial to the psoas major, there will be two nerves over here. Okay, medial to the psoas major. Could you able to see two nerves? Medial to the psoas major, could you able to see two nerves over there? Lateral, no. Just pull it. Yeah. Okay, be gentle. This is the accessory obturator nerve. This is the main obturator nerve. Accessory and main. Okay. So these nerves are lying medial to the psoas major. Okay. Medial to the psoas major, obturator nerve and accessory obturator nerve. Accessory is thinner and obturator nerve is thicker. Okay. Okay. Leave it. Okay. Okay. They will be gentle only, no? Because our research thing. Okay. Okay. Next one, see here. The next nerves are, this is the psoas major. One nerve will be lying in front of the psoas major over here. See here, this nerve lying, piercing. You can see that it is exactly. This is piercing the psoas major over here. Could you able to see that? This is piercing at the level of this part, upper part of the psoas major. Could you able to see that? Further above, you can't see any nerve over here. Okay. This is a nerve which is piercing the psoas major over here and lying in front of the psoas major. This is a genitofemoral nerve. Genitofemoral nerve. This is the genitofemoral nerve. Okay. So far we have seen medial to the psoas major and over the psoas major. Now we are going into the lateral aspect of the psoas major. Okay. Obturator nerve and accessory obturator nerve. Okay.
Obturator nerve, accessory nerve.
Okay. Lateral to the psoas major or in between the psoas major and iliacus muscle, a bigger trunk you can see. That is nothing but the. Nothing will happen, no? Nothing happened, no?
No.
Okay.
Nothing happened.
Lateral to the psoas major, a thick nerve you could be able to see. That thick nerve could you be able to see that? That is the femoral nerve over there. Could you able to see that? That is the femoral. Okay, shall I pull it up? Just a moment. You can see from there now clearly? Could you able to see from there, right? Or not? Could you able to see from there? Okay. This nerve is the femoral nerve. Could you able to see that? This is the femoral nerve. And one nerve, again lateral to the psoas major, which is a thin nerve, which is cutaneous nerve, which will be going towards the notch situated in between the anterior iliac spine and anterior inferior iliac spine over here. See here, one nerve will be going over here. Could you able to see that? This nerve going towards the notch in between the anterior iliac spine and anterior inferior iliac spine. Could you able to see that? Right? That nerve is nothing but the lateral femoral cutaneous nerve of thigh. It is going towards the lateral aspect of the thigh over here. That is the lateral femoral cutaneous nerve of thigh. It is associated with the femoral nerve because the origin is same for the femoral nerve and lateral femoral cutaneous nerve of thigh. We'll be discussing that later. Okay. So just remember, lateral to the psoas major will be femoral nerve, bigger trunk, and smaller nerve will be the lateral femoral cutaneous nerve of thigh. Okay. And you can see the femoral nerve is supplying, giving rise to two branches over here to the iliacus. Could you able to see that? These branches from the femoral nerve which is supplying to the iliacus over here, right? So far we have seen medial to the psoas, over the psoas and lateral to the psoas. Now, towards the lateral border of the quadratus lumborum, could you able to see that? This is the iliacus, psoas major and quadratus lumborum. Towards the lateral border of the quadratus lumborum, you can get, hold it, one nerve over here. This nerve, okay, just lateral to the lateral border of the quadratus lumborum. This nerve is nothing but the ilio-hypogastric nerve. Okay, just again a little bit below to the hypogastric nerve. This nerve over the quadratus lumborum is the ilio-inguinal nerve. This is the ilio-hypogastric nerve. This is the ilio-inguinal nerve. How to remember? Towards the lateral border of the quadratus lumborum will be the ilio-hypogastric nerve. Little below that will be the ilio-inguinal nerve, but over the quadratus lumborum again. Okay. Right. And finally the subcostal nerve. Somebody feel the rib over here. I can't show you the subcostal nerve over here. It hasn't dissected yet. Hold it over here. Hold it. Okay. This is the subcostal nerve. This is the subcostal. How can I say this is the subcostal now? There is a rib over here, 12th rib. You can feel the rib over here. Try to feel it. Try to feel the rib over there. That is the rib. But you will feel that.
Okay. Yes, sir.
Right? That is
Yes,
the rib.
yes.
Floating rib, that's why it is half.
Half, it's half.
Okay. Okay. But you will see that. But you will feel it.
After the
No.
little paper.
Just over here.
Wait,
Huh? So feel here, feel here, feel here, feel here, over here. But you will feel that. Okay, half rib. So below that rib, if you find any nerve over here, that is a subcostal nerve.
Okay.
But you will see that. This is a subcostal nerve. This is a subcostal. Okay. Just below the 12th rib over here, this is the subcostal nerve. This is a subcostal nerve. That means where the subcostal nerve is present. For example, if this is the 12th rib over here, below the 12th rib will be the subcostal nerve over here. Are you able to see that? Okay. Towards the lateral border of the quadratus lumborum, there will be iliohypogastric. Above the iliohypogastric will be the subcostal nerve because 12th rib is present over there. Because quadratus lumborum will be attached to the 12th rib. Below the 12th rib will be the, if any nerve comes, that is nothing but the subcostal nerve. Even below the subcostal nerve will be the lateral border of the quadratus lumborum. So there will be iliohypogastric nerve. Understood or not? Okay. From above downwards, if you name the nerves, first of all subcostal nerve, then followed by
Iliohypogastric nerve,
then followed by
femoral nerve,
lateral femoral radius nerve of the, then followed by
femoral nerve,
then followed by genitofemoral
Genitofemoral
then followed by
accessory nerve, accessory nerve.
So this is a sequence of the nerves from all the way from above downwards. Okay, everybody has seen or not? And one more thing, you are supposed to see the relation of the hilum of the kidney over here. See properly over here. This is the vein. Could you able to see that? This is a vein over here. Okay, and it will be passing in front of the aorta over here. Okay, left renal vein will be passing in front of the aorta because this vein will be draining into the inferior vena cava over here. Okay, we will be seeing that later. Okay, and one more relation I forgot to tell. Here will be the origin of the superior mesenteric artery. Is it not? Superior mesenteric artery will be behind the pancreas. Is it not? So this will be sandwiched in between left renal vein below, splenic vein above. Could you understand? For example, if the pancreas is present over here, behind the pancreas will be the origin of the superior mesenteric artery. So here are the kidneys. Is it not? Here are the kidneys. These are the kidneys. This is the pancreas. So below the pancreas is the kidneys. So left renal vein will be all the way going from left side over the aorta and draining into the inferior vena cava over here. Okay. So to the superior mesenteric artery, below will be the left renal vein, above will be the splenic vein over here. Understood or not? Because splenic vein will be within the pancreas over here. Okay. Right. So that is the relation. Okay. Let us see the relation of the at the level of the hilum of the kidney over here. Hilum of the kidney means nothing but the structures entering in and going out. Okay. Okay. See here, this is a vein, thin-walled again, thin-walled renal vein over here. Okay. And then this is the artery, renal artery. Could you able to see that? This is the renal artery. And this is the ureter over here, pelvis of the ureter. Yes, what is the sequence? Vein, artery, and pelvis of the ureter. Nothing but the ureter from anterior to posterior direction. Anteriorly vein, first of all, then followed by the artery, then further followed by the ureter over here. Vein, artery, and ureter. Even behind is the ureter. This is the relationship of the hilum of the kidney over here. Anterior to posterior direction. Okay. Anything I left today? No, that's all for today.
Sir, once more genitofemoral nerve.
Genitofemoral nerve, this one. This is the ureter going all the way. You can see that ureter is crossing the psoas major and the iliac process and everything over here. So ureter is going all the way from posterior to urinary bladder will be over here. So all the way from posterior it is crossing over here from posterior to anterior direction and going to the urinary bladder over here. Okay? You will understand. Urinary bladder will be just behind the pubis. Is it not? Right. So this is the genitofemoral nerve. This is the genitofemoral nerve.
So this is ilioinguinal.
That is ilioinguinal. If you find it in front of the psoas quadratus lumborum, yeah, ilioinguinal, absolutely, ilioinguinal. If you find any nerve over here, that is the iliohypogastric nerve. Okay, just remember the hallmarks. Lateral border of the quadratus lumborum will be iliohypogastric. In front of the quadratus lumborum will be ilioinguinal. Lateral to the psoas major will be femoral nerve and lateral femoral cutaneous nerve of thigh. Medial to the psoas major is the obturator nerve and accessory nerve. Below the 12th rib will be the subcostal. So if you remember the hallmarks, it is an idea. Okay, right? That's all for today. We have to dissect. Me and Sneha are dissecting in this, so we'll be dissecting further. Okay. On Tuesday we'll show the rest of the vessels and everything. Okay.